The Marina Del Rey Hospital HealthCast, featuring the doctors of Marina Del Rey Hospital.
All right, Dr. Watkins, a lot of people have questions for you, want to get your opinions on back problems. Let's go out to the phones. Adrian, you're next on with Dr. Watkins.
About 16 years ago, I had an emergency C-section, and they gave me an epidural. Ever since then, whenever I bend down, I get stuck. And now the pain has begun to radiate down my right leg. I'm wondering what I can do about that.
That's a great question. I've had patients with similar complaints and experiences. As far as getting the epidural, and if anything happened at the time of the epidural or just having the medicine infused, if that caused some type of injury that you're persisting to have, unfortunately, there's not a lot that can be done after that. However, your pain may be coming from something else. It may be coming from the disc, some irritation of the nerve, overgrowth of the facet joint. I see people all day long with back and leg pain that slowly gets worse as the years go on. And so generally we start with plain x-rays to see what the structural alignment looks like. And then we get an MRI to see what the soft tissue looks like. Is there a disc pushing on a nerve? Is there any irritability of your nerve roots which form the sciatic nerve? Is the key part to know what the diagnosis is, what's the source of the pain, and what the potential treatment is. Generally, our treatment for back and leg pain is any oral medications to decrease the inflammation, potentially doing an epidural injection. Now, epidural injections that I do for pain relief are different than epidurals that are done for labor and delivery. The epidurals for labor and delivery are basically block out all the nerves in your legs so you don't feel anything. The epidurals that I do basically are like a cortisone shot. It's an anti-inflammatory steroid to decrease inflammation, and they generally last for a couple months, whereas the epidurals for labor and delivery are very immediate and just act for that time. So the space they're injected into is the same. They're both the epidural space, which means around the nerves, but it's different medicines we're injecting for two totally different purposes. So the treatment for you would be number one, make the diagnosis. Number two, decrease some of the pain and inflammation, and then get you into physical therapy. And if we get your core muscle strong and take some stress off your disc and off the back, we may be able to decrease the back and leg pain that you're experiencing. And that's generally the most effective treatment. Obviously, if the MRI shows a disc pushing on a nerve or some overgrowth and some real nerve impingement, there's always an option for surgery. But realistically, I'd say we only operate on 10 to 20% of all the patients we see. 80 to 90% of the patients we see, we treat non-operatively. And that goes for professional athletes and everyday people. We see so many professional athletes every year that almost all of them we treat non-operatively. It's pretty rare we actually operate on people. So most people we can treat non-operatively, but making the diagnosis is the first step.
Adrian, thank you for your call.
Thanks, Dr. Watkins.
The Marina Del Rey Hospital HealthCast, featuring the doctors of Marina Del Rey Hospital. For more information on any of the topics discussed, please call the Marina Del Rey Hospital helpline at 855-51-SPINE or go to marinahospital.com.